Hello, this is Dr. Cindy Nagel from Horizon Dental. Welcome to the November edition of Tip Tuesday. I'm very excited, as always, to be doing a live video on Facebook, and I hope that if anybody has any questions that I will somehow see them on here. I'm using my phone today, so it's a little bit of a different format. Also, thank you so much for the feedback that I've gotten. I appreciate it so much, and it's inspired me to change the format of Tip Tuesday slightly. I realize that the videos so far have been quite lengthy, so what I'm going to try and do is shorten them and maybe do them a little bit more frequently. So please stay tuned to our Facebook page to be updated on topics, and as always, the videos will be saved on our Facebook page, as well as our website, horizondental.clinic, and our YouTube channel. So thanks for watching. Anyways, this month's edition of Tip Tuesday is about hypnosis, which I was inspired to do because I just this past weekend was in Vancouver and I took a course on clinical hypnosis for dentists. It's a very different kind of topic, kind of eclectic, which suits me very well. So just to jump right in there, of course, what is hypnosis? The general question. And what's interesting is that we don't really know. None of the experts can really agree on what hypnosis is, but the way it was explained to me is that it's a quieting of the conscious mind. Similar to meditation, very similar to guided meditation, I found anyways. And what you're doing is hypnotists help achieve a state in people where their conscious mind is quieted and they can influence the subconscious mind. And that's why it can be very, very successful for people who are looking to quit smoking, lose weight, having issues with motivation or other mental health issues, because it sort of targets that inner brain of ours, the one that knows everything, the one that has all of the intuition and just doesn't have a chance to act because we're so cerebral and we're always thinking all the time. So it's been very, very successful. It's also been very successful in medicine. There are several doctors across the world that use hypnosis with their patients. There was a video that they showed us at the course of, I believe it was 60 minutes, with an ER doctor who was hypnotizing his patients to help them get through trauma and get through those experiences. And it was amazing what he could do. I imagine he's a much better hypnotist than I am. But it's also been very successfully used in dentistry for a number of different issues. Of course, targeting anxiety and pain management. There's, again, if you Google dentists and hypnosis, there's a bunch of YouTube channels of people who have had tooth extractions with no pain management other than hypnosis, which I am not ready to try anytime soon, but is absolutely fascinating. It shows you what the mind can really accomplish, in the right circumstances. One thing that I did learn a lot about was reducing the gag reflex, which I know can be a big problem for a lot of people, especially when we're working in the mouth and we're, of course, stimulating that wonderful gag reflex, and it can make things very difficult. So just to describe the experience that I had at this course, in a word, I would say it was very, very interesting. I was a little bit skeptical at first. Hypnosis, like I said, is kind of eclectic, and I wasn't sure what I was getting myself into, but it was just absolutely fascinating. And I had the opportunity to try to hypnotize other people, but I was also given the chance to be hypnotized myself, and it was just such a different experience. I was successful in hypnotizing my partner and got rid of his gag reflex for a time. So I felt very accomplished because I did not think I knew what I was doing right off the bat. But it's a very intuitive process. It doesn't have to be complicated, and that's what's so amazing about hypnosis. For myself, what I was expecting when going through this process of being hypnotized, I thought that I would fall into some kind of trance. I was expecting to be transported somewhere or to have this kind of spiritual experience. And really, my mind was still going. I was still thinking, okay, this is a little bit silly. I don't really know what's happening, and I was doing the visualizations and it felt very silly, but I was also feeling very focused, and I think that was part of the key, is that it's able to help you focus your mind. So my partner was also successful in eliminating my gag reflex for a time. And one of the instructors, I actually volunteered, she hypnotized me so that I couldn't really feel my left hand, and they were able to successfully pass a needle through the skin of my hand, and I did not feel a thing. I'm not sure that I'm ready to test that out on anybody just yet, but it was really fascinating stuff. So anyways, what I'm hoping to do with hypnosis, of course, is to use it to enhance my day-to-day dentistry. I'd like to take these techniques and see if I can help my patients. I'd like to work with some people who do have issues with a gag reflex or anxieties, and see if hypnosis is going to help enhance their experience with the dentist. I see that, Chelsea. I would love to try hypnotizing you. I think it would be amazing. And I think as I become more and more practiced, I think the easier it's going to get. I'm also excited to try it sort of in combination with some of the other approaches that we do. Of course, those of you that know me, know my clinic, you're aware that we offer a wide variety of sedation options and other, anxiety management treatments to try and make your visits as easy as possible. So I'm thinking that it's going to work very, very nicely with the laughing gas, with the nitrous oxide, because it already sort of transports people to sort of one of those places. It does help people relax, and it sort of quiets that mind, which is exactly what hypnosis is trying to achieve. So I think together it's going to have some pretty amazing results. So I'm very excited. Of course, hypnosis probably doesn't work for everyone. Again, I was very shocked that it worked at all on me, because I did not feel like it was working at all, but it did. And so I'm hoping to see what people think. And yeah, I'm looking forward to trying it out on some people. And who knows, maybe I will get somebody running around the office clucking like a chicken. You never know. Anyways, of course, if anybody has any other questions about hypnosis or other methods to help with anxiety regarding the dentist, please message me or leave a comment on this video. I'd love to hear your thoughts, and if anybody has any ideas for the next set of Tip Tuesday videos, of course, I'm always excited to have help brainstorming the next Tip Tuesday. So have a good evening, everyone. Take care. Thank you.